Welcome, everyone, both in the room and online. Glad that you were able to join us for the Mary Fournier Goldson Lecture of 2023. My name is Melissa Begg, and I have the honor of serving as Dean of the Columbia School of Social Work. The Goldson Lecture offers us an excellent opportunity to come together and strengthen the social work practice of family and child support professionals. It was established in 1991, and the Mary Fournier Goldson Lecture honors the vision and memory of its namesake, a member of the Columbia School of Social Work faculty and a tireless advocate on behalf of children and families. And the purpose of this lecture is to keep that vision and that legacy alive. And we continue Dr. Goldson's commitment and devotion to the field of child welfare. So I'd like to say just a few more words about Mary Fournier Goldson. She was born in Birmingham, Alabama in 1935. She earned her BA from Bennett College in North Carolina and her MSW from Case Western Reserve University. In 1969, she joined CSSW, where she directed programs in child welfare. And she was a treasured teacher and colleague until her untimely passing in 1990. Before joining Columbia as an assistant professor, she was director of the Community Consultation Center of the Henry Street Settlement, where she was responsible for supervising the comprehensive community health program. She served on numerous boards and was a member of key child welfare organizations, including the Citizens Committee for Children of New York. Professor Goldson was also a consultant to the Lower East Side Family Union and Family and Children's Service agencies in New York, New Jersey, Ohio, and Florida. She was a significant force in shaping integrated and comprehensive services to families and to children. And her colleagues described her as a superior teacher who could light up a classroom with her ability to engage students. She was a dedicated social work professional and a remarkable person, and I'm actually really sorry that I never got to meet her. But now, we're going to move forward, and I have the pleasure of introducing tonight's moderator, my amazing colleague, Dr. Brenda Jones-Harden. Dr. Jones-Harden joined us as the Ruth Harris Ottman Class of 45 Professor of Child and Family Welfare on July 1st of this past year. She came to us from the University of Maryland School of Social Work. It has been an honor and a complete joy to be working with Brenda here. Dr. Jones-Harden is the president of the ward at 0 to 3. That's a nonprofit dedicated to ensuring that all babies and toddlers have the strongest possible start in life. Dr. Jones-Harden's research focuses on the developmental and the mental health needs of young children who have experienced early adversity. She is, in her own words, a scientist practitioner who uses research to improve the quality and the effectiveness of child and family services and to inform child and family policy. Now, she began her career as a clinical social worker, working with vulnerable children, and her experience as a clinician has ignited long-term research interests in child welfare, child well-being, and prevention science. Dr. Jones-Harden is not only a child welfare expert, but she's also an outstanding researcher whose work spans early childhood, child development, child welfare, prevention science, and enables her to evaluate the impact of programs and systems on child well-being for the most vulnerable children. She's published extensively in leading peer-reviewed journals in a variety of fields. She earned her BA in social science and Spanish from Fordham University, a master's in social work from New York University, and her PhD in developmental and clinical psychology from Yale. Brenda, thanks for leading us tonight.
Thank you. I'm so glad to be here. Last year, I was the Goldson lecturer, and now I am a faculty member. So I'm very excited about that. And even more excited that I'm here for this particular presentation. So you all know that April is a time where spring is finally saying to us, we're coming, finally. It was warm today, but it's also National Child Abuse Prevention Month. And I think because it is very important that we have somebody like Alan here. So in the spirit of prevention, which is at the core of my own work with children, I am so pleased to introduce Alan Dettlaff. I've known him for a long time, and we have some things we agree on and some things we don't disagree on, but that's okay. We work together in the spirit of helping kids. So he's a professor and former dean at the University of Houston Graduate College of Social Work. He began his career in child welfare like I did as an administrator. I wasn't an administrator. You got that. But I was a clinician. But he was also a practitioner in that field. Today, his work focuses on ending the harm that results from the system that he learned about as a young social worker. He is the author of the forthcoming book, Racist Intents, American Child Welfare in the Afterlife of Slavery and the Case for Abolition, which is going to be published by Oxford University Press. But he also has written a lot of books about racial disproportionality, of which I have contributed when he nudged me to hurry up and get my chapters in. He is really the creator of the Up In movement, which I'm sure most of you have heard about, which is a collaborative effort that is dedicated to abolishing the family policing system and building alternatives that focus on healing and liberation. He received his bachelor's degree in social work from Texas Christian and master's and PhD in social work from the University of Texas at Arlington. So without further ado, I'm so excited to hear your talk. Thank you, Alan, for coming.
Thank you, Brenda. Well, thank you all. I'm very happy to be here with all of you today. I want to thank Dean Begg for inviting me to be here, to Dr. Jones-Harden for that introduction, and to all of you for being here in person today, and to the memory of Mary Goldson. It's just really an honor to be a part of that legacy, and I hope that this honors her legacy and all of the work that she did for children and families. I wanted to start out with a little bit more background about me and my time in the child welfare system as a little precursor to how I got where I am today. I obviously didn't start out my career in the system as an abolitionist. I started my career in the child welfare system back in the mid-1990s. And at that time, I was kind of an aimless junior college student. I knew that I wanted to do something that involved working with children and families, something that involved helping them, but I didn't know what that would look like. I spent some time as an education major, then I was a special education major. And then one night I saw a news story about reporter who went on a ride along with a child protective services worker and realized, wow, that's the work that I want to do. That's how I could really make a difference in children's lives. I changed my major to social work. I did my undergraduate internship with Child Protective Services in Fort Worth, Texas. And then I went to work for the agency just after I graduated. As Dr. Jones-Harden said in my introduction, I worked for that agency for a total of 6 years, 5 of those years as an investigative caseworker, and then in my last year, supervising a unit of investigative caseworkers. So in that time, my job was to investigate maltreatment, which means that it was also my job to remove children from their families when it was deemed necessary for their protection. And, you know, when I think back about that time, I think I probably removed upwards of 100 children from their families, maybe 10 to 15 a year. And when I think back on my time in that system, I realized that although I thought I was doing good at that time while I was in the system, I was very young, I was very ill-prepared, and I was very unaware of how my own biases were impacting the decisions that I was making in that system. And it wasn't until after I left the agency when I became involved in the state's efforts to address what the state calls racial disproportionality, which is the overrepresentation of mostly Black children in the system. I remember thinking that that was the first time I heard about racial disproportionality. It wasn't a problem that was discussed when I was working in the system. I only learned about it until after I was in the system. And it was only until after I left the system that I started to come to understand the harms that family separation causes and my own complicity in the harm of family separation. Because when I thought back on many of the cases in which I removed a child, I realized later that most of those children didn't need to be removed, that there were things that I could have done that could have prevented removal, but I was caught up in what I refer to as a culture of removal, where that's just what's done. It's done all around us. And there's no one really checking or asking questions if that should really be done or not. And the harm that I caused to children and to families, and I could remember vividly most of the children that I removed, is something that I really think about daily. The harm that I not only caused to them then, but the harm that they're probably still dealing with today in their lives. I also realized that of all of the children that I removed, not once ever did a child say to me, "Thank you so much for removing me from my horrible abusive parents." That never happened. And when I would go back to see those children, all those children wanted to know is when they could go back home. And these were cases that involved harm in some cases. And what I realized then and what I realize now, that there are cases where children want harm to stop, but they don't want to be separated from their parents. And the reason is because they love their parents and their parents love them. And the love that they had for their parents is not something that I understood at that time, because if I had, I would have spent more time making more efforts to try to prevent the removals that were happening. So today I'm going to talk a little bit about, start with some of the issues that are currently occurring in the child welfare system related to racial disproportionality, but I'm also going to try to connect that to some of the racist history of the system and how that racist history of the system led us to where we are today. A lot of the research that I did for my book coming out this fall is contained in this lecture. And actually the title of the book has changed to the title that you see on the screen. It's actually had about 5 changes since then, but this is the current title of the book. And it just was emailed this morning. The book comes out September 1st, which I'm really excited about. So I want to start just as a framing device with some myths and realities of the child welfare system, just to see if we could all get on the same page with some things. So when we talk about myths and realities, here are a few common myths of the child welfare system. The child welfare system is a helping system. It is necessary to separate children from their parents to ensure their safety and well-being. When children are separated from their parents, they live in safe and loving foster homes. Parents are offered services to address their needs. And although racial disparities exist, these are largely due to disparities in poverty. Do any of those sound outlandish or things you haven't heard before? Okay. So let's take a minute to just take one of these at a time. The child welfare system is a helping system. I would say it depends what you mean by help. The reality of the child welfare system is that up to 70% of children nationally and up to 85% of children in New York are forcibly separated from their parents because of what the state calls neglect, which is largely associated with poverty. Many people think that the child welfare system is protecting children from harm through some type of abuse, but that's not the reality. Up to 70% of children are in foster care because of poverty. Only 16% of children in foster care right now are in foster care because of any kind of physical or sexual abuse. So the system is not really protecting children from harm. It's necessary to separate children from their parents to ensure their safety and well-being. Again, what are we separating them for? We're separating children largely for poverty. Is it necessary to separate children from their parents to help them deal with their issues of poverty? No, absolutely not. And in fact, separating children from their parents because of issues of poverty, and even in cases where there's harm, just causes more harm. When children are separated from their parents, they live in safe and loving foster homes. Is that true? It can be, but what we know is that rates of physical and sexual abuse are actually 2 to 3 times higher in foster care populations and in group home settings. So the child welfare system is not protecting children from harm and is actually causing greater harm to children than in the general population. Parents are offered services to address their needs. That's one that's often thought of. Many people who are making calls to Child Protective Services are making those calls because they think some help will be provided, but that's not the case. Parents are not receiving services to address their needs. And in fact, that's because of the logic used by the family policing system, which we call a carceral logic, which views problems like poverty, which is a societal issue. Really, poverty is a societal failure. And rather than viewing it as a societal failure, carceral logic and the child welfare system pathologizes parents and blames poverty individually on parents. So carceral logic says that parents are individually responsible for their poverty, and as a result, they need to be treated for that poverty. So the result then is that in a typical case, a parent doesn't need childcare, she needs parenting classes. A parent doesn't need affordable housing or a living wage or adequate income for quality food. She needs budgeting help and nutrition training. If a parent disagrees with her treatment plan, then she needs counseling. And if she strongly disagrees with her treatment plan, then she needs anger management classes. That's how carceral logic manifests in the child welfare system. And in most cases, the child welfare system actually has zero resources to help children or parents with their poverty. If a child comes into foster care because a mother left that child alone while she had to go to work, the child welfare system cannot offer them childcare. They have no resources to do that. So that's one of the main problems with the child welfare system, is that they literally are not helping parents in the way that they need help. And then, although racial disparities exist, these are largely due to disparities in poverty. There are social work professors right now, many prominent social work professors, who will tell you that that is true. And I'm here to tell you that it's not. At best, it's a mischaracterization. But racial disparities do not exist because of poverty. They exist because of racism. And I'm going to talk about that right now. So when we think about racial disproportionality and disparities, which really undergirds a lot of abolitionist thought, it's because of the disproportionate impact that the child welfare system and other carceral systems have primarily on Black Americans. In the child welfare system, racial disproportionality refers to the phenomenon of being out of proportion. So you could be out of proportion either underrepresented, or you could be out of proportion overrepresented. In the child welfare system, disproportionality refers particularly to overrepresentation, and particularly to Black children's overrepresentation in the system. Nationally, Black children are about 25-26% of children in foster care, and they represent only about 13 or 14% of children in the general population. That means they're overrepresented in the population. That is factual. That's just the raw numbers that tell us that Black children are overrepresented in the system. What's important to know about that is that we've actually known that for more than 60 years now. This book in the center of this slide, Children of the Storm, was written in the early 1970s to point out the problem of the overrepresentation of Black children in the system throughout the entire 1960s. Many calls for reforms were made in that book, and nothing has changed. The book on the left, yes, your left, Racial Disproportionality in Child Welfare, was written by Professor Marion Harris in around 2010. The one on the right, I edited in 2021. I wouldn't recommend that book because it's before I had some of the thinking that I had now, so it's more of a reformist book. But the idea here is that the child welfare system has known that racial disproportionality has existed, and people have been writing about it for 60 years, and nothing has changed in that entire time. When we talk about racial disparities, that's a slightly different concept, whereas disproportionality compares Black children in the population to Black children in foster care. Racial disproportionalities look at differences in outcomes between Black children in the system and white children in the system. And what we know is that when we look at differences between Black children and white children in the system, we know that Black children are more likely than white children to be reported for maltreatment, to be substantiated or confirmed for maltreatment, to be forcibly separated from their homes through what the system calls removal. And then we know that once children are in foster care, Black children are less likely than white children to exit foster care to reunification. And this kind of chart on the right, it's actually called a simplified flow of child welfare decision-making. That doesn't look very simple to me. But the idea is, we're not going to go through this. The idea is every diamond on there represents a decision-making point. At every one of those decision-making points, Black children experience worse outcomes than white children in entries and exits. And that's what creates disproportionality. You have disparities in entries, disparities in exits, and that creates this buildup of Black children in foster care. Again, the important thing to know about racial disparities, this is not contested at all. These are data that have been shown again and again at the national level, at the state level, at local levels, not contested. What has been a little more contested over the years is why racial disproportionality and disparities exist. When I talk about why disproportionality and disparities exist, I think it's important to start at the beginning of this. So I'm going to show you a few pictures here. Where are these pictures from? These are pictures from anti-abolitionist newspapers of the 1850s that depicted the forcible separation of children from their parents. And that's what's important to know about the source of racial disproportionality in the child welfare system as a result of family separations, that the forcible practice of separating Black children from their parents was first used as a means of controlling Black families over 400 years ago as a practice of human chattel slavery. And that practice of forcibly, involuntarily separating Black children from their families was used specifically by the state as a means of maintaining the power and control of a system of white supremacy that was foundational to this country's origins. Historical evidence tells us that the practice of family separations was vast and pervasive to the extent that as few as 1/3 and as many as 2/3 of children experienced some form of forcible separation from their family members. And accounts of those separations are horrific. They talk about formerly enslaved people describing not just the profound loss and grief that would come from those, but also the cruelty associated with that practice. They tell of infants who were sold away simply because their crying annoyed their enslaver. They tell of infants who were either sold away or literally beaten to death because their presence was impeding the sale of their mother, because an enslaver wanted to buy the mother only and not the child that came with her. And the intent of family separations at that time was incredibly clear. Separating children from their parents was the cruelest form of punishment that enslavers could think of. They knew that it was feared more by parents than any kind of physical attack, than rapes, any kind of physical violence. So they used family separations, not only as a means of punishment, but as a means to create fear and maintain both compliance and to prevent any kind of rebellion. If enslaved parents disobeyed their enslavers or indicated any kind of dissent, family separation was used as a means of punishment. So fundamentally, the destruction of Black families was the defining characteristic of human chattel slavery and the mechanism by which the state maintained Black Americans' subjugation. When we move forward, I think it's important to talk about family separations that occur today within that concept, that family separations began in this country because of racism, because of enslavement, dehumanization, forced family separation. But then what followed abolition of slavery were laws and policies that were created specifically for the purpose of maintaining the white supremacy that was now threatened through abolition, specifically through the Black codes. What we saw following abolition of slavery and through passage of the 13th Amendment were Black codes, which were passed to severely limit the freedoms of Black people outside of their system of enslavement. Black codes denied voting rights. They prohibited interracial relationships. They restricted where Black people lived. They restricted employment for the purpose of wealth accumulation. And particularly, they turned crimes that were formerly misdemeanors into felonies if they were committed by Black people. And that aspect of the codes was specifically designed to create a system of mass incarceration of the formerly enslaved for the purpose of creating a system of free labor that was lost during slavery through convict leasing programs, which are sometimes referred to as chain gangs. And the abuse that was inflicted during convict leasing programs was even more severe than the torture that was inflicted during slavery. Why do you think that might be? Any ideas? Why would the torture be worse during convict leasing than slavery?
Because the convicts put up more of a back talk, or what you would call.
It's actually that's a good thought, and probably wasn't some suggestions. It was actually Charles. Kind of. It's because they were just rented. Slaves were people's property. And although they did inflict violence on them, they had to essentially make sure that they stayed alive and healthy to continue producing labor. When they were just rented, the people who were renting them could inflict any kind of violence and torture that they wanted on them without any kind of repercussions. So the violence during convict leasings, and people who were in convict leasing programs were as young as 10 years old. The violence there was extreme. What happened after Black codes were Jim Crow laws. Those were passed around the country to not only cement the restrictions that were in the Black codes, but mandated segregation in businesses, schools, access to public places. And all of the Black codes, Jim Crow laws, it's important to understand, were deemed constitutionally acceptable through 1964. And what we see is that accumulation of laws and policies intentionally designed by the state to maintain the subjugation of Black Americans worked. The results of those are poverty that we see today and disproportionate rates of poverty. You've heard of things like the wealth gap, the income gap, education gap. All of those things are the accumulated effects of hundreds of years of policies put in place to maintain Black American subjugation. We also see that this is where health disparities come from. Many people think about health disparities as having some genetic relationship to them. You heard a lot about that when in the early days of COVID and the health disparities. Of course, I'm sure all of you know that that has nothing to do with genetic causes. But many people often think of racism as causing mental health problems, which it does, but racism has been shown to actually lead to physical deterioration on the body, a phenomenon called weathering that's been studied quite a bit. The daily experience of racism contributes to a physical breaking down of the body that leads to health disparities. And then, of course, we see differences in geographic contexts, things like residential segregation, redlining, implementation of the GI Bill that only allowed less than 1% of Black veterans to receive access to the services from the GI Bill, have led to conditions of concentrated poverty that we see today. All of the factors that you see here on the screen are factors that make it more likely that Black children and families will come to the attention of the system, of the child welfare system, but it's not because of poverty. It's because racism caused all of these things. But then moving away from just these societal reasons that make it more likely for Black children to come to the attention of the system, I want to talk for a minute about the history of the child welfare system. And it's within the context of the need to protect white supremacy, the same reason that the Black codes and the Jim Crow laws started, that the origins of the modern child welfare system emerged. The history of the child welfare system, as is the history of most government systems that began in the late 1800s, were directly for the purpose of maintaining the supremacy of white people through the subjugation of Black people. And throughout its history, racism has been embedded in the policies and structures of the child welfare system from the late 1800s when the very early origins of the system began. Does anybody know what this picture is? The orphan trains, exactly. Many of you have probably heard of the orphan trains. A brief recap, the orphan trains were a system developed by Charles Loring Brace in 1853, who was a Methodist minister, and he started an organization called the Children's Aid Society that was primarily focused on addressing the needs of poor, orphaned and abandoned children who were living on the streets of New York. Many of them were orphaned and abandoned due to the difficult labor conditions of the time. Many of their parents were indentured servants. And Charles Loring Brace and many of the other elites in society were concerned that these children were engaging in petty crimes, theft, different things like that. They were becoming nuisances to the neighborhood. Charles Loring Brace believed that if he could put these children in a home with good, upright, moral Christian parents, that they could be trained to become productive citizens, that they could learn the value of hard work, also learn the value of Christianity, and become good citizens. And because of the rapidly expanding West at this time, he developed a system where these trains transported children to the homes of rural Midwest families, who in exchange for their labor were provided with homes, food, and some type of parenting. And you'll hear people say that over between 1853 and the early 1920s that the orphan trains were in operation, that the trains relocated over 200,000 children from New York to the rural Midwest. What that statement leads out is the fact that the orphan trains relocated over 200,000 white children from the streets of New York to the rural Midwest. One, because Charles Loring Brace was racist and believed that Black children were inferior to white children. He also probably rightly believed that families in the rural Midwest would not want Black children to be in their homes. But what's important to understand about this time in history, not just the orphan trains, but also the settlement house movement of the time, the other charitable organizations of the time, that were all designed as poverty relief citizen building programs for white immigrants, mostly white European immigrants, intentionally excluded Black children from all of those services. So not only were Black children excluded from the orphan trains, they were included from charitable organization societies, they were included from the settlement house movement. And not just because the emphasis was placed on saving white children from poverty, they were excluded because Charles Loring Brace, Jane Addams, other people at that time fundamentally believed that Black children were irredeemable, that even if they were to provide those services to Black children, they wouldn't be able to take that information, that training in, because they were beyond becoming a productive citizen. So racism is absolutely at the core of what began the child welfare system. The orphan trains largely died out in around the 1920s, 1930s. And then what we see next is the history of the modern child welfare system. In 1935, I'll go through this slide quickly because this could probably be a whole hour session by itself. So 1935 quickly was the beginning of the Social Security Act, and particularly aid to dependent children, which later became aid to families with dependent children. And what's important to know about ADC at that time was it was specifically established as a poverty relief program for white mothers whose husbands had either died or been incapacitated. So the purpose of this relief was to prevent white mothers from having to enter the workforce so that they could stay at home with their children without any source of income from their husband. Due to changes in migration patterns throughout the 1940s and 50s, changes in population, generally, Black families started to become more and more eligible for these poverty relief programs. And as a result, ADC started to implement very restrictive eligibility clauses. Most people refer to them as illegitimate child clauses or man in the house clauses that were for the purpose of excluding Black children from receiving these services or for the purpose of expelling Black children from welfare rolls. And what we saw in the late 1950s is that states, particularly Louisiana and Florida, systematically expelled 20,000 to 30,000 Black children from their welfare rolls en masse because of these illegitimate child or man in the house clauses. That drew enough public attention to lead to the Fleming Rule in 1960. The Fleming Rule said that states could no longer do that. They could no longer use these illegitimate child clauses to dispel children from welfare rolls. But it also said that for the children who were expelled, they needed to be investigated to see if they were quote unquote safe. So what you have then is a phenomenon of tens of thousands of Black families being investigated by white caseworkers to determine if they were safe. And if they were deemed unsafe, changes to the Social Security Act through the Public Welfare Amendments in 1962 made it more and more likely that foster care would be used as the cure or as the relief remedy for neglect. So at that time, really, these changes in policy, the Fleming Rule, the Public Child Welfare Amendments, led to the beginnings of what we now call racial disproportionality, because tens of thousands of Black children entered foster care because they were living in poverty. What really changed, though, changed the landscape of child welfare. It was still about poverty relief. In 1962, Henry Kemp released the Battered Child Syndrome. Prior to the Battered Child Syndrome, there wasn't much national concern about child abuse or physical abuse. It wasn't something that was really talked about. This changed everything. It led to a national scare about child abuse. Henry Kemp was featured on Newsweek, Time Magazine, TV shows, and it was about really serious physical abuse. There was a national scare, national panic, people called it. And that national panic led to the creation of state mandatory reporting laws, because there were already existing child welfare systems, but their focus started to change. Rather than being about poverty relief, mandatory reporting laws and this rise of concern about child abuse led to states' mandates shifting from poverty relief to surveillance and protection. Between 1963 and 1963, 2 states had mandatory reporting laws. 1968, we saw all 50 states have mandatory reporting laws. And also in 1962, there were 662 cases of child abuse reported. By 1968, there were 11,000 cases of child abuse reported, which shows you just how rapidly the implementation of state mandatory reporting laws led to reports. And as you might suspect, Black children were immediately disproportionately impacted. In 1968, Black children were the subject of 45% of all reports that went into child abuse hotlines, even though they were only 8 to 9% of children in the population in that time. Many of those calls, although mandatory reporting laws started out as solely being about severe maltreatment, were about neglect and conditions of poverty. What we saw then is that in 1974, CAPTA, the Child Abuse Prevention and Treatment Act, was passed to federalize mandatory reporting laws and make it consistent across all 50 states. What CAPTA did, though, for the first time, even though state laws differed widely on how they thought of neglect, CAPTA for the first time enshrined neglect under the same category of child maltreatment as physical abuse and sexual abuse were. So there was one category of child maltreatment, which included physical abuse, sexual abuse, and neglect. What's important to understand about CAPTA is that by the time CAPTA passed in 1974, there had been a decade of research to show that mandatory reporting laws were disproportionately impacting Black families. And they were severely disproportionately impacting Black families largely because of their poverty. That was well known by everyone who was involved in discussions by CAPTA in 1974, but the law passed anyways. So people will often say things about unintended consequences of CAPTA, unintended consequences of other child welfare laws. If you know that something is going to cause a disproportionate harm to Black families, you go ahead and pass that law anyways, and then those disproportionate harms become reality. That's not an unintended consequence. That was the intent of the bill, to disproportionately harm Black children and families. And that's how we get to where we are today with the intended consequences. 53% of Black children today will be subject to a report of maltreatment by the time they reach their 18th birthday. Black children are twice as likely to be forcibly separated from their families than white children. In some cases, that's as high as 3 times as likely. Nationally, 1 in 11 Black children will be forcibly taken from their parents. And in some states, it's 1 in 8 children that will be forcibly taken from their parents. Before we leave this section, I think it's important to point out that all of the discussions about mandatory reporting laws started in 1962 and ended around 1974. What else was happening in society around that time? The civil rights movement. It's not a coincidence that during the same decade that saw the end of Jim Crow laws through passage of the Civil Rights Act, the same decade that saw expansion of voting rights through the Voting Rights Act, child welfare systems across the country shifted their models from poverty relief to surveillance and separation. That time in history, between 1962 and 1974, saw some of the most horrific acts of violence inflicted on Black Americans since the era of slavery, including the lynching of Emmett Till, the blocking of the Little Rock Nine from entering Central High School, the violence directed at freedom riders throughout the South, blocking of Black students from entering the University of Alabama by Governor George Wallace, the bombing of the 16th Street Baptist Church by the Ku Klux Klan, the assassination of Malcolm X, and the violence inflicted on the Selma marchers. That violent backlash during the same time as conversations about mandatory reporting laws were going on formed the backdrop of this rapid expansion of mandatory reporting laws. And thus, to me, what we see here is that throughout our history as a country, when white power is threatened, it responds with white rage. At certain times throughout our history, we see white rage manifested through horrific acts of physical violence, as we saw during slavery, as we saw during the Civil Rights Act. But then in times of our history where overt physical violence is less accepted by the general public, then we see white rage enacted through policy, which is what happened with CAPTA. From the Black codes to Jim Crow laws to the laws that maintain the child welfare system, policy is the tool used by the state to channel white rage for the maintenance of white power. And just as the family separations that happened during slavery, just as all of the violence that ensued during the Civil Rights Act, we see today, particularly related to family separations, that the harms of family separations during the time of chattel slavery are the same harms that have extended through generations. Consider these following statements. The scientific evidence against separating children from families is crystal clear. No one in the scientific community would dispute it. It is not like other topics where there's some debate among scientists. We all know it's bad for children to be separated from caregivers. Given the scientific evidence, it is malicious and amounts to child abuse. Their heart rate goes up, their body releases a flood of stress hormones such as cortisol and adrenaline. Those stress hormones can start killing off dendrites, the little branches in brain cells that transmit messages. In time, the stress can start killing off neurons, and especially in young children, wreaking dramatic and long-term damage, both psychologically and to the physical structure of the brain. To pretend that separated children do not grow up with the shrapnel of this traumatic experience embedded in their minds is to disregard everything we know about child development, the brain, and trauma. And lastly, the effect is catastrophic. There's so much research on this that if people paid any attention at all to the science, they would never do this. When were these quotes made? In 2018, at the time of the zero tolerance policy. This tells me that there is a disconnect in our public consciousness about family separations. During the era of human chattel slavery, the horror of family separations was known to all, so much so that images that I showed you earlier and stories of family separations were plastered across anti-abolitionist newspapers. The last image that I showed you is an image from Uncle Tom's Cabin that was the second most sold book during the 1850s that contained a story of a newborn baby being separated from his mother that led to national outrage about family separations. So much so to the point that there's a story, unverified, but a story that says that when Abraham Lincoln met Harriet Beecher Stowe, the author of Uncle Tom's Cabin, he said, "So you're the little lady that started this war." So family separations and the visceral horror that everyone could understand as a parent led to white Northerners coming on board to the abolition movement. And then we saw this again during the Trump administration. The blatant cruelty of forcibly separating children from their parents led to national outrage. We started to see pictures plastered over the news. There was a recording of a young child screaming "mommy" and "poppy" while border agents were heard in the background laughing at them. Everyone understood the trauma that was being caused. In total, nearly 3,000 children were separated from their parents during the entire zero tolerance policy. That number is less than the amount of children forcibly separated from their parents every week by the child welfare system in the United States. In fact, the child welfare system separates over 200,000 children from their parents, and that goes largely unnoticed. A quote like this, though, the effect is catastrophic. There's so much research on this that if people paid attention at all to the science, they would never do that. That's being done to over 200,000 children every year by the child welfare system. And people are willfully ignoring the science behind that. And then following the initial trauma of separation, we know that children who experience foster care also grow up to experience incredibly poor outcomes as adults. There's some debate on research done on outcomes of children in foster care because many of those studies that are done compare children who age out of foster care to children who have never experienced foster care. And there are huge disparities in poor outcomes there. But there's been a handful of studies, about 6 in total, that have compared children who entered foster care to children who have experienced similar forms of maltreatment, but the caseworker made a decision to retain those children in their home for them to receive in-home services. So these are not severe cases, but cases that essentially could have gone either way. Some cases were removed, some cases, or there may have been other risk factors, but some cases there was a removal, some cases children stayed in the home. And what we know is that children who experience removal, even though they experience same forms of maltreatment, have 2 to 3 times higher delinquency rates, higher teen birth rates, lower earnings as adults, twice as likely to have learning disabilities, 6 times more likely to have behavioral problems, more likely to have substance-related disorders, psychotic or bipolar disorders, depression, anxiety disorders, and have arrest rates 2 to 3 times higher and are more likely to have criminal convictions for violent offenses. These are the outcomes of foster care. The state is well aware of these outcomes, and the state is well aware that these outcomes occur disproportionately for Black children and families. So while the history of separating Black families in the United States began during chattel slavery as a means of maintaining their oppression, the oppression of Black families now is maintained by a vast government system of social control that knowingly inflicts harm on Black families through the same act of forcible family separation. And while the system will tell you that those separations are based on the need for protection, the outcome is the same: the subjugation and oppression of Black Americans. Think about these outcomes. Black children in America are already at greater risk of experiencing these outcomes just because of the racism that they deal with day to day and all of the resulting issues of racism that we talked about earlier. When the state then implements an intervention on children known to result in houselessness, joblessness, poverty, incarceration, the state is acting as an agent of oppression by knowingly inflicting harms on Black families and resulting in the very conditions that maintain their oppression today. The state is causing that. So that brings us to some questions to consider. Can a system that began with a racist intent evolve into a system that achieves racial equity? Can decades of racist policies be revised to no longer produce racist outcomes? And is racial equity even an appropriate goal for a system that produces harm? The answer to all of these questions, spoiler alert, is no. And I'll start with the last one here, because I think this is an important one. If you're involved in working with the child welfare system at all, if you're following what they're doing, racial equity is without question the system's priority right now. They talk about it in Brenda and I have been on webinars where the focus is on racial equity. And this is a letter from Asia Schomburg, the Associate Commissioner for Child Protective Services, called Equity is a Right. And in the larger box I pulled out here, I believe we can make it better for the generations to come. At the federal level, we are scrutinizing our current policies. We're having tough conversations, and we're identifying policies that exacerbate inequity, and we are prioritizing them for change. We're conducting equity impact statements and asking ourselves, are we administering our programs equitably? Are we serving the families that need it most? Are we removing the obstacles to access? What more do we need to do? So the focus is clearly on equity. On the surface, a goal of equity makes sense. Think back from a few minutes ago. If the problem in the child welfare system is disproportionality, meaning overrepresentation, the solution is proportional representation, which is racial equity. But think about what racial equity really means. All racial equity means, if the system were to achieve racial equity, that means that hundreds of thousands of children would still be forcibly separated from their parents. They would just be distributed proportionally by race. That does nothing to solve the actual problem of the child welfare system. The problem in the child welfare system isn't the overrepresentation of Black children. The problem of the child welfare system is the racist abuse that's been inflicted on Black children and families for decades. Equitable harm is still harm. And as a result, equitable harm cannot be the intended goal of any social service system. So racial equity cannot be the goal of the system. Which brings us to the Upend movement. At the Upend movement, we believe we can build a society where children and families are strengthened and supported, not surveilled and separated. I think where there are many differences, you would probably all believe say that that's a great goal to have. Many of us, like me and Brenda, believe this goal. We have slightly different opinions on how we get to this goal, but I'm going to talk about that. And there are many ways, many people think we can get to this through reforms of the system. There are even people now who are talking about transforming the system. Some of the federal efforts want to transform the system into a child and family well-being system. At Upend, we don't think that's the direction that we should go. And the reason is because we think that reforms are no longer sufficient. The child welfare system has been in a constant state of reform for 60 years. Efforts like, and even currently, reform efforts that are happening now are things like diversifying the workforce, cultural competence training, anti-bias training, lots of reforms around decision-making tools, structured decision-making, predictive analytics, blind removals. You've probably heard of all of these reforms or know something about them. None of them work, even though they've been done again and again. Blind removals is a very popular one, which essentially takes a case that's potentially subject for removal, removes all identifying information from the case, demographic information, and then presents it to a board of supervisors or administrators to determine if a removal should happen or not. First of all, the thing to know about blind removals, if a state adopts blind removals, that says that that state believes their workforce is so racist that the only way they can guarantee unbiased decision-making is by taking all identifiers out of the case and giving it to a panel of experts. But what we really know is that it doesn't work. There's been evidence that have shown that blind removals do nothing to actually reduce racial disproportionality in the system. Yet, that hasn't prevented the system from continuing to adopt blind removals. There are states right now that are adopting the blind removal process all over the country. Predictive analytics is another that largely started out of Allegheny County, a model that was developed by social work researchers that has now been shown to increase racial disparities in the system when it's used. Despite that, Los Angeles County is in the process of adopting predictive analytics, that exact same tool right now. Why? Because that's how reforms work. Reforms are a means of distracting the public from the reality of what's happening in the child welfare system. So the public is upset, a legislative body is upset, the child welfare system saying, we're on it. We're implementing blind removals. We're implementing predictive analytics. They can't explain what predictive analytics do, but they've been told by the people who developed that it's this very fancy system that is going to eliminate human decision-making from their models. And that appeases the general public for a while until the next crisis comes around. But what we really know about reforms, what we believe at Upend, is that reforms essentially ask the child welfare system to do the impossible. Reforms ask the child welfare system to forcibly separate families that's a little bit less racist, a little bit nicer, a little bit more palatable to the general public. But the problem with reforms is that they fundamentally misunderstand the problem of the child welfare system. The problem isn't that we need a child and family well-being system. The problem isn't that we lack a multicultural workforce. The problem isn't that we need to access better training. The problem is that the system itself was designed to harm and oppress Black children and families, and it does it exceptionally well. Reforms will never be able to address that. So at Upend, we believe that eliminating the harm and oppression that result from family policing intervention will only be achieved when forcible and involuntary separation of children from their families simply is never used again, is not deemed acceptable by society as an intervention. Which brings us to abolition. When I start talking about abolition, I always begin with this quote from Ruth Wilson Gilmore, who says that abolition is presence, not absence. And this is a really important idea about abolition because many people who haven't been able to really fully understand what abolition is about believe that abolition is primarily focused on tearing systems down, ending police, ending prisons, shutting down the child welfare system. That's not what abolitionists spend most of their time thinking about. What abolitionists really spend their time thinking about is how we can build a society that has the conditions within it so that people have everything they need to thrive. People have everything they need to live safely in their homes and communities. People have resources to eat. People have resources to take care of their children. All of the things that would make the need for prisons, policing, child welfare obsolete. We focus much more on the building up. And I think we all want to do that as a building up part of society. So a couple more quotes here from prison abolitionists to show you how these movements intersect with each other. The first one on the right here is from Derricka Purnell, who says, abolition is not merely the absence of police. It's eliminating the root causes of harm, and it's eliminating the kind of society that could rely on police to solve that harm. And I think that's parallel to the child welfare system. One of the questions that people ask me most often related to abolition is, what would happen to children who are horribly abused? And my answer to that, when you take that as a macro picture, I say that's not the question we should be asking ourselves. We shouldn't be asking if there's no child welfare system, what will happen to the children who are abused? We should be asking, why do we live in a society where children are abused by their parents, and what could we do to address that? That's the question that abolitionists are concerned about. Robin D.G. Kelly says, abolition works to dismantle systems that cause harm and reallocate funds to social and economic resources, and to develop new systems of community-controlled public safety and restorative justice. So again, you could see the idea of reallocation here. This is essentially what defunding the police is about. It's about disinvesting and reinvesting. Right now, we have a system of foster care that spends $30 billion maintaining those children in foster care. And really, when you go back to what I was first talking about, how children are separated largely from poverty, what we have is a system that forcibly separates children from their parents, largely because of poverty. And then it places those children in the home of a stranger to take care of those children, and then pays that stranger money when all those children's parents need is money. That's ridiculous that we have a system that does that. In Texas, we pay foster parents an average of about $900 a month to take care of someone else's children. What if we just gave the poor mom who's struggling to meet her child's needs $900 a month? Her children wouldn't need to be in the child welfare system. That's ultimately what abolition is about. So as I said kind of before, abolition is not really just about ending harmful racist systems. It's about creating a society so that the need for harmful racist systems is obsolete. So what we see here at abolition is really about a simultaneous process of ending and building. Ending the use of involuntary separation, but also building meaningful supports so children can be safe and protected in their homes. I'll expand on that a little bit more because I want to be clear. Although abolitionists enjoy the process of talking about building and creating a lot, we also really do want to end the system. So I don't want anybody to think that we're not focused on ending the system. Abolition absolutely means the elimination of the current child welfare system, which is built on a model of surveillance and separation, and a fundamental reimagining and recreating of the ways we care about children and families in society. And that's what we see here on this side. By building, what abolitionists are focused on is building a society where families have meaningful, concrete support, meaningful financial, concrete support, where residents of communities intervene when needed, where residents of communities are viewed as first responders rather than social service medical providers. Community members provide support to those who need it. There's a sufficient array of community-based services, interventions that exist in the community, and that there's a system of care that can address and minimize harm. So it's residents of communities caring for residents of communities. That's what abolitionists are looking to build. I should say, none of this is going to happen tomorrow. This is a long-term project, but if we are successful in building these things, and there are actual real policy strategies to build each of these things, we can create a society where the child welfare system is obsolete. Because we know not only do all of these things, but particularly direct material financial assistance, not only does that address issues of neglect, it also significantly reduces instances of actual physical abuse, physical harm that happens to children. At the Up In movement in 2021, we released this policy document called How We End Up, which is our roadmap to abolition. It includes 7 steps to get towards abolition. 3 of those steps are about dismantling, 4 are about ending, 4 are about building. So we want to end involuntary separation, reunite children currently in care, and end surveillance through things like repealing mandatory reporting laws. These are explained in much more detail in the report. And then in terms of the building, we want to prioritize care over punishment, which really is focusing on issues of harm reduction. transform societal conditions into things like, so we have things like universal basic income, guaranteed child allowances, free access to transportation, free healthcare, mental health care, substance use treatment for those who want substance use treatment. Reimagining care for children and families that is done in non-carceral ways. And the primary issue is shifting powers to families and communities so that they're the deciders about what happens to the families and communities that they care for. We've also developed a framework for evaluating what we call reformist reforms versus abolitionist steps toward ending the family policing system. And what this tool does in the abolitionist language, a reformist reform is a reform that tries to tweak an aspect of the system, but actually winds up giving more money to the system through training, additional family policing agents, additional resources. A reformist reform is expanding foster care from 18 to 21. A reformist reform is the current 21st century Families Act that Karen Bass proposed, which rather than repealing the Adoption and Safe Families Act, would just extend the timelines for family termination from 15 months to 24 months. Those reforms make things a little bit better, but they do nothing to end the underlying harmful architecture of family separations in the system. What we want to see are reforms that lead toward shrinking of the system. So we've developed a tool here where you can take any reform and ask yourself these 8 questions. Does the reform reduce the reach of the family policing system? Does it reduce the prospect of harm? Does it diminish the legitimacy of the system? Does it reduce the power of the system? Does it increase access for families to direct supports? Does it promote healing for children, families, and communities? Does it promote child, family, community autonomy? And does it promote a society where the need for the child welfare or family policing system is obsolete? Any reform or initiative can be run through this tool to see if it's actually leading towards abolition or just reifying the system. I want to close with another quote from Ruth Wilson Gilmore. This is one of my favorite quotes from her, partly because Ruth Wilson Gilmore is brilliant, but also because she gave this quote at a lecture at the University of Houston a couple of years ago when I was dean and invited her to give a talk. And what she says is, abolition is a way of seeing. Abolition makes you ask, when you look, what are you seeing? And what would you rather see? When we look at the child welfare system right now, we see a system built on a model of surveillance and separation. We see a system that disproportionately surveils Black bodies, a system that disproportionately separates Black children from their families, and a system that responds to families in need of intervention in a way that causes those families more harm. We see a system that was created to ensure that Black children and families exist in poverty and remain in poverty. We see a system that exists to establish a narrative that the condition of poverty inflicted on Black Americans by the state is the result of individual pathology among Black people, and particularly among Black mothers. We see a system that was created as part of a broader national project to maintain a system of racial capitalism ruled by white elites that depends on the continued subjugation of Black Americans. And we see a system that replicates the harshest form of punishment during slavery to ensure this subjugation of Black Americans continues. What we would rather see, as Ruth Wilson Gilmore says, what we would rather see is a world where children and families have everything they need to be healthy, to eat, to live safely, and to thrive in their homes and communities. We'd rather see a world where families are interconnected with their communities and freely seek help without fear of judgment or punishment. We'd rather see a world where the idea of family policing would never be brought into existence because the idea of forcibly separating children from their families is so repellent. We'd rather see a world that's not dependent on the subjugation of some to further the supremacy of others. A world that would look upon the horrors of human chattel slavery and agree that those horrors can never be repeated. A world where true equality is fully realized. Because abolition is fundamentally about hope. Abolition is about hope for another world and the belief that another world is possible. And that hope has existed long before us, going back to the original abolitionists, and that hope is going to continue. What's important to understand about that hope is that, as many people believe, it is not a misguided hope. It's not a dream of a utopia beyond our grasp. It's a hope for something we know is possible, because the idea that it is impossible is not something that we can accept. And it's the hope that fueled centuries of those who came before us, and the hope that fuels all that's being done today. And all across the world we wish to see as possible, steps are being done to bring that world into existence across the globe. And those of us who hope for this new world, we know that it's within our collective power to bring about that change. And we know that our collective power is greater than those that wish to deny us that freedom. Using our collective power requires some risk, and we know that using that collective power will come from backlash from the white elites who control society. But we know that we will continue. And we know that we will continue because we have to continue, because not continuing is not an option. We'll continue that because we understand that our current reality cannot continue. And that's the work of abolition. And that is the work that will continue until we are free. Thank you all very much. I appreciate the opportunity to be with you all. I'll give a brief plug for my book that comes out in September. Much of this presentation is based on that. I just learned today the release date is September 1st, so I'm really excited about that. And now I'm happy to take hear some questions with Dr. Jones-Harden.
Get to questions first because you came. So
I'm wondering, in your research, are there elements that you've uncovered that in the system that are also like not just eliminating but exploitative as well in terms of children and families? I think a lot about like connecting this work to how like labor laws are loosening in this country, and like seeing that there's like 15-year-olds working in Chick-fil-A, 14-year-olds working in Chick-fil-A. Like what element is that in terms of like the capitalist machine, to put it that way?
I haven't seen that as much in labor exploitation. What I've really seen is how the system is exploiting young people in foster care for sex work, and the trafficking that goes on in that aspect of the system. There's literally a group home in Texas specifically for young girls who have been trafficked that was closed down last month because it was trafficking the staff were trafficking the girls who lived in that home. So that's where we see a lot of exploitation through sex trafficking among foster children.
What do you think about what's going on now with the increase of doctors being involved with taking children, babies from the parents? As you were talking, that is just what we just had. There was just a case in Houston, actually, and that's just really all I kept thinking about. So what are your thoughts?
Are you thinking about the one in Dallas just last week? I don't know about a Houston one.
It could have been, it was Texas. I'm sorry. I'm a little early. Yes, it could be Dallas. Yes.
Yeah, there was a Dallas case for those of you who haven't or are not familiar with or don't follow this news. There was a case in Dallas last week where a newborn, about 2 weeks old, was removed from her parents because of a minor medical condition. The baby had a slight case of jaundice, and it was being treated by the family's Black midwife. It's a Black family with a Black midwife. Their pediatrician didn't trust that the midwife knew what she was doing, called CPS, and CPS took custody of the children and still has custody of the children now. It's a important medical issue to be taken care of, but one that's rather simple with some intervention and does not require family separation, particularly when we're talking about a newborn like this who's literally still breastfeeding. I think these are the problems of mandatory reporting laws, and why many of us involved in this work, one of the first things we think needs to happen is to repeal mandatory reporting laws. The problem with mandatory reporting laws is, first, state definitions of abuse are incredibly vague, and they also come with severe punishment for failure to report. So people think they have to report everything or they'll lose their job, their license, there'll be some consequence, when in reality they don't have to report everything, but they think they have to report everything because of this fear. And then it leads to situations like this. In this case, this baby could have received medical care, was under treatment of this midwife. Their doctor didn't believe that the midwife was capable of providing the treatment. But that's the harm of mandatory reporting laws and the fear that comes with them.
Yeah. First of all, I agree with your analysis and with every single point that you put forth.
Thank you.
But my question is, are there any conditions at all under which you would want to remove a child from their parents?
Ultimately, no.
Yeah.
Well, not removed by the state.
Mhm.
When I think about, harm that happens to children, and I don't want to minimize that harm does occur to children. In addition to that macro issue of looking at why harm occurs and addressing those factors, when we think about it on the micro level, the way I like to think about it is to ask you to think about your own family, the network of people you love and care about. Imagine that a child in that family was harmed. What would you want to happen? Would you want to get together as a family and community and decide what's in the best interest for that child and how you could protect that child from further harm? Or would you want the state to come and take that child away from you and decide on their own what needs to happen? I think most families would prefer the former. And if you want that for your own family, then you should want that for every family. And if you want that for every family, then that's abolition.
But when I'm thinking of our cases, which we see, where a child's arms and legs have been fractured by parents, and where there's been serious physical harm, much less psychological harm. In those cases, would you want to remove? And if so, what would be the alternative?
I think, first of all, I think it's important to point out that that is less than 1% of cases. And when we focus on those cases, we tend to, then our focus is on something that's ignores the 70 or 80% of children who are harmed by the system that because of poverty and don't need to be a problem. The other issue has to do with the shifting power issue. I'm not saying that those children shouldn't be separated from their parents. I'm saying that it shouldn't be the state to decide that. I'm saying that it should be families and communities who have that responsibility for themselves to determine what happens.
So how would that happen legally? That's an intriguing idea.
Again, it's not something that's going to happen tomorrow. And it would take some changes in our current laws and policies. I mean, right now, the law dictates that the child welfare system respond to those cases. So it would be many policy changes that would lead to that, but it would give families, communities autonomy to make decisions for themselves. Provided, though, this is like the ending and the building part. It would be under the condition that those families and communities have all of the resources that they need to address the harms that are occurring, which we don't currently have.
Sorry to go back a half step. I would be really excited to hear you answer Dr. Feldman's question or example of using a white supremacy sort of lens and framing a response in the context of white supremacy.
Could you say that a little bit more so I understand?
So the premise of abolitionists or challenging sort of state child welfare system is fundamentally white supremacy, right? It's the surveillance and separation and destruction of Black families. So I would love to hear the answer in the context of white supremacy analysis.
Yeah, the answer has actually already happened in our history. When I talked about all of the Black families that were excluded from child welfare services in the late 1800s, early 1900s, Black families and communities got together and created their own agencies outside of state systems, and they cared for each other because the state was not caring for them. And that's what we need to recreate. We need to trust Black families and communities to care for each other, as we've already seen that they can do throughout our time. White supremacy says, this will go away in a second, that the state is the parent, essentially, through if you think of parens patriae, kind of the initial idea that society was, that the state is the ultimate parent. That comes from a white lens of thinking, because in the idea at the time when that concept, parens patriae came from England, from Europe, but there wasn't a need for that thought toward Black children at the time because Black children were cared for by their enslavers. So it came out of this white idea that the state was the ultimate parent. And then what we really saw is that it extended to an idea of white saviorism, which we saw, say, in the early 1900s with the real rise of the juvenile legal system, when Black children started going very quickly into that system. And the white saviors of that time focused on helping poverty relief for white children, punishment, incarceration, other types of things for Black children, but believed that they were saving those children, even though they were punishing them. So the system today operates still from a white savior mentality.
Are there systems in other countries that you could point to that do this well? Yeah, that's.
There are systems in other countries that don't view poverty or neglect as maltreatment, that provide support for families and don't view it as maltreatment. We view it as maltreatment in this country because of what CAPTA established in the 1970s. So they still have systems of child protection and they still forcibly separate children from their families. They just don't do it for neglect. One of the places in the US that I think is a good example that we could learn things from is the state of Vermont. Brenda, do you know a lot about them? I don't know as much about them as I need to. I know that in Vermont only of their children in foster care, only about 1.5% of children in Vermont that are in foster care because of neglect. And they have a model that essentially co-locates their child protective services system with all the other public safety net systems. If a call comes in for a poverty related issue, they just literally redirect it to these other agencies and someone gets assigned to it. So they just don't remove for neglect. And that's just a value system of that state, compared to say something like Texas, where I think it's something like 87% of children are removed for neglect. So that's a model that we could learn from.
Yeah, that's what I was going to say. I think we have a lot of, Alan might disagree with me, but a lot of good models within this country where there are communities that say we're going to approach this in a different way, so that instead of, sending children right away to child protection, they do things like create an early childhood system of care. Like I think what they're doing, trying to do in Durham with Family Connects, where they get those kids at the very beginning, these kids that where the physicians are calling in and reporting these kids, but they're sort of doing it from a universal prevention standpoint. So I think we have some good examples in communities in this country. What hasn't happened, and this is what Alan is pushing for, and this is, I think, where our disagreement is, I am not as optimistic as him. I think we live in a racist society that's not really going to create the support system that he thinks we can. But I do think that there are communities that have said, we're not going to let this happen to our kids anymore. And so they've created these systems of care, and I know mostly in the early childhood world, systems of care where you do get children in childcare and you do get families in home visiting and you try your best not to get them in child protection, and you see the rates of removals, but also the rates of referrals, which is the bigger problem, because the data that you cite about over half of Black children are going to see child welfare in their lives. I mean, that's crazy. That is just ridiculous. And that's the statistic that always drives me up a wall. But you've seen in some of these places where they can reduce the number of referrals, which is the further problem. So, Alan, there were some other questions that came from the folks who were excited about you coming. And one question was, why abolish it instead of transforming? And wouldn't abolishing do more harm than good?
Great. I kind of spoke to that, and this is because we literally tried that. We're probably on like the 13th time of transforming the child welfare system, and it doesn't work. And it's because every reform effort, every transformation effort maintains the act of forcible family separation. And as long as the state continues to have that power, they're going to continue to implement that power. Many family separations come out of a fear of liability on the part of the state. It is the safe decision of the state to remove a child rather than leave the child in that family because of potential consequences that could happen to the caseworker or to the agency. So as long as that power remains, nothing will change. And we've seen this over time. Rates of disproportionality have gone up, they've gone down. It's been a problem for 60 years. So reforms just fundamentally don't work. I disagree with the idea that it causes more harm. I actually think our current system causes more harm right now. what the system does, it responds to harm in a way that causes more harm to children. Through just the act of family separation foster care, rates of physical and sexual abuse in the system are higher than they are in the general public. So the way that I think about it, it's abolitionists who really care about reducing harm and caring for children, because the system is not doing that right now.
So I'm going to take the moderator's prerogative. So, and I'm going to go back to what Dr. Dolan said. So one of my favorite books as a social work student was For Reasons of Poverty, the Pelton book. And one of the things, anybody remember that book? I've been around. Oh, you remember. Thank you, Jason. Somebody remembers it. But one of the things that they talked about was really creating a different system for the children who were exposed to abuse. In the 75%, you're right, of kids who are neglected, who I frankly don't think should be in this system at all. What would be your reaction to that? So a separate system for the kids based on the child maltreatment, right?
I still don't think that's what we should be looking towards, because a separate system still causes harm to those children. I think there are ways that we can prevent, or either prevent harm or stop harm from occurring in ways that don't cause further harm. Forcible family separation causes harm every single time.
I agree. I totally agree. I know about the trauma that children, and anybody read Viola Davis' book? Oh my God, please read Viola Davis' book. Oh my God. But anyway, she talked about the trauma of growing up in a house where her parents were engaged in lots of physical violence and all this kind of stuff. And I thought about it as you were talking, because of course she said, I love my mama and daddy. She called them my mama and my daddy. And she loved them and she could never imagine being apart from them. But I do think what gets those families into the system is really different than what gets families into the system who are substantiated for neglect. So I think in my mind, our approach needs to be different, although I agree that we know enough about reducing child abuse that we could do something for those kids. But should we leave them there in the middle of violence, which is trauma? And I'm agreeing that when we remove them, we're creating more trauma. So I'm completely in agreement. But is it sensible to leave them in homes where they are being exposed to that kind of violence?
First, I think we can think about, if we start with the 70–80% of children who are in the system for neglect, and if we stop removing those children and redirect those funds to families and communities, we would see rates of those kinds of harm go down. So we would see rates of actual harm decrease as well, which are largely related in many cases to impoverishment. The serious cases that you're talking about, I'm not saying that children should be forced to stay with them. I think the decision shouldn't be the states to do that. I think the decision should be the people who care about that child.
Okay. It's hard for me. You know it's hard for me, because I've seen too many kids. Okay, I'm gonna go to a different question. So one person was asking about, how do you ensure that children's and families' voices are central to your abolition movement?
Oh, that's essential. One, I would say, Upend is just a small arm of the abolitionist movement. I know you at Columbia are very fortunate to have a partnership with JMAC for Families, Joyce McMillan, who is probably one of the most brilliant abolition thinkers that I know, and is an impacted parent. There are many other organizations. Movement for Family Power is one. There are other youth organizations that are very involved in the abolition movement. So Upend, the way that I view our niche in this broader collective, is really the more academic arm of the movement that we write thought pieces, we contribute to conversations, we put out policy documents, and hopefully some of these organizations, these more on the ground grassroots organizations, are using. One of the things I'm really proud of is that our document, How We End Up, was used in a Michigan Supreme Court case last year, arguing against termination of parental rights of a child. So I think our work is getting into those spaces, into legislative spaces that I hope will make a policy difference. But I think it's important to keep in mind both me as part of Upend and that we're just a small part of the movement. But even in our own work, all of us who lead Upend, and there's like 4 or 5 of us that founded Upend, we all have experience on the other side of the system. So we're former administrators, caseworkers, lawyers, family representatives, but we work very closely with children and parents who are involved in the system. We consult with them regularly. They write materials. We compensate them for everything that they do with us. So having those ongoing connections and collaborations are really important, many of whom are based here in New York.
Well, thank you for this thought. And whenever I hear you, I mean, my brain is always running.
Are we out of time already?
Yeah, but thank you for this thought-provoking talk. Any last comments you want to make before I turn it over to Melissa to close us out?
I would say if you're interested in learning more, just go to our website, upendmovement.org. We have many resources there. And this year, we're actually working on a project that we kind of affectionately call the Elephant in the Room series. But it is going to be a document that lays out what happens to the series, what should happen to the seriously abused children, what should happen to the children with parents that are using substances, what should happen to the children whose parents have mental health concerns, what should happen to the children in homes where there's interpersonal violence. So similar in the prison movement, they have lots of documents that's called the What About the Rapists, which is a question that prison abolitionists are asked all the time. So we're in the process of developing that for ourselves. And maybe you could help as a reviewer, Brenda, on that. But go to our website, upendmovement.org. Also, and if you're interested in learning anything about abolition, there are so many excellent books to read about it. I would recommend Becoming Abolitionist by Derica Purnell. Dorothy Roberts just wrote a book specifically about family policing called Torn Apart. And obviously Angela Davis. The first book that I ever read about abolition was Are Prisons Obsolete by Angela Davis, which is literally like 100 pages long. And it's just a beautiful, beautiful piece of work that really explains what abolition is about. And thank you all again for being here in person. Thank you all, everybody watching online. Thank you, Dean Beg, for inviting me.
It's such a pleasure. And I'm so grateful we have these named lectures that allow us to bring scholars and advocates of your caliber here. Brenda, thanks for the great moderating, and for Alan for a terrifically packed, well-constructed presentation. I learned a huge amount, and it was fantastic. And I love the dynamic between the two of you. This is what we need more of. But yeah, it's great. It's great. But thanks to you. Thanks, everybody.